We're a single 10 MSSP ACO considering submitting Medicare CQM quality metric results. I'm unsure whether we are allowed to construct the JSON file ourselves that we'll submit on the QPP website. Obviously, we could use a registry to do this, but we already have all of our data at the ready, our list of ACO beneficiaries, and the ability to craft a simple JSON file. Is there any obstacle to me authoring the JSON file for my ACO quality submission myself?
Great question, Sean. Yes, you can submit it yourself, but there is a barrier you will have to overcome. Web interface reporting that just sunset was intended and designed to be self-serve. But to submit Medicare CQMs, you have to be a Medicare qualified registry. Your submission must include a valid registry identifier to be accepted. It's achievable. I built my first qualified registry when I was director of clinical informatics in the community health system in which I was a member of the family practice residency faculty. Since then, I've been involved in the creation of 8 additional registries, Mingle Health being my latest and greatest. The first step toward doing it yourself is to find and download Medicare's Qualified Registry Self-Nomination Toolkit. In searching for it to prepare this answer, it was a little difficult to find. I found it in the resource library on the qpp.cms.gov website. Download the 2025 MIPS guide to using a QCDR or qualified registry. In it, you'll find a link that will take you to the 2025 Self-Nomination Resources Toolkit. The toolkit is a zip file containing 4 PDFs that describe the requirements and the process for initial qualification and the requirements and process for annual maintenance of qualification. Initial qualification is mostly a set of attestations, assert that you have or attest that you have a certain set of skills, capabilities, and experience. Annual requalification involves demonstrating that you are reporting, that your reporting is accurate, and they'll get this just from the normal day-to-day actions of a registry, creating and following an annual audit plan, attending monthly mandatory meetings with CMS, and participating in random CMS audits as requested. You'll probably need at a minimum 3 FTEs buried in this process. 1, a subject matter expert, keeping eye on the rules and the proposed rules, the opportunities and threats, how they relate to you and your organization. 1 technical resource to manage the electronic processes that collect, analyze, format the submission, and submit the data. And an administrative asset to keep up with the Medicare requirements, connect to your practices to keep the accurate, usable data flowing. We have a massive group working on this, including about 7 people who read the rules every year to make sure we don't miss anything. I recognize that I'm more than a little self-serving when I say, leave it to the professionals. Don't try this at home, folks. I'm not sure I would still be a qualified registry if I were still working in a community health system and not fully dedicated to this work now. Now, no single requirement of the process is particularly difficult, but Medicare changes the rules frequently and sometimes with very little advance warning. There are a lot of details and obscure requirements, creating an environment in which small errors are easy to make. And some of those small errors can have big consequences. They can invalidate a submission, costing a healthcare system millions of dollars in uncollected shared savings or negative MIPS adjustments. Medicare publishes a list of qualified registries every year, and I'm seeing the number of registries diminish year over year. Attrition seems to be particularly large among the do-it-yourself organizations. Some of our happiest clients are those who have done it themselves in the past, now pleased to be free of the tedium. We're delighted to help you if you would be so kind as to engage us. It's what we live for. Great question, Sean. Thanks for that.